Hi there, it's a new episode on Let's Talk Health, and my name is Chinomso Amadi. Today on the show, we shall be looking at something fresh, birth control. It's referred to as family planning. Now, in this day and age, you will agree with me that planning your family, knowing the number of kids you want to have is very important given the harsh economic situation. Some people still do not believe in this, but trust me, it is very important. Having the number of children you can cater for is key. They will thank you later on for that. But before I join my guests for today, Dr. Tony, let's go on this quick break. We'll be right back. Welcome back. If you just tuned in, the program is Let's Talk Health, and today Dr. Tony will educate the mothers and fathers and yet to be parents watching right now on birth control. Stay tuned. If you're just joining us, and welcome to the interview segment. And I have with me today Dr. Tony Agaja. Thank you for joining us today.
Hello.
Okay, you're talking about birth control, and I bet there are lots of questions that people would want to ask about this topic.
Definitely.
But first of all, why is it necessary to use birth control? Why is it necessary?
Well, we have so many reasons. First and foremost, it's economically,
Okay.
and then for the health of the woman as well. Spacing your child, not having too many kids, and so for the health of the woman, for the economic status of the family, it's very important to limit our family size.
Okay, so I know there are different methods of birth control. Can you enlighten us?
Well, I think we should first of all tell the viewers what birth control is.
Okay.
Yes. So birth control is synonymous with family planning and fertility control. It's any means, method, or device used to prevent pregnancies. Okay. So birth control has been in existence since man himself, because our forefathers have been using birth control methods. Before anyone decides to use birth control, you have to decide that there are different reasons for why you want to use birth control. So basically what informs your decision, you could take the decision by yourself, or you could take it with your partner or spouse or husband. And the things you would consider before choosing any method of birth control would be the cost, the use, the side effects to you personally, the availability, and the practicability. And then lastly, your cultural or religious beliefs.
Okay. So what are those different methods that are available?
Birth control, basically you have from the most effective to the less effective, right? So the most effective would be sterilization, which can apply to both the male and the female. So they surgically cut the tubes and ligate the tubes for the male or the female, either vasectomy or tubal ligation in the female, as the case may be. There's school of thought now that it's reversible, but then it's the most effective. So coming lower, we have the IUDs, which are the intrauterine devices, and those are inserted. You have some that last for 3 years, some that last for 5 years, and some that last for as long as 10 years. Right? Then we have the pills. So you have the birth control pills, the oral contraceptive pills. Some are combined, some are singular. And on that category, you also have the emergency contraceptive pills. All those are under the pills. Then you have the injectables. You have the implants. Then you have the barrier methods. We're now coming lower to the less effective methods of birth control. You have the condoms, that's the male and the female condoms, the femdoms. You have the vaginal rings. You have the cervical caps. You have the diaphragms, and then the last and the least preferred for we health practitioners would be the withdrawal methods, which people still use, but then it's not very effective. You have the withdrawal methods, and then you have the fertility awareness method.
Okay.
And that also has a lump of categories.
Okay. So far from what you said, I think the first one you mentioned is the most effective.
Yes.
So which one is the best? Like that first one?
That's the thing. There's no best.
There's
it's
no best.
individual dependent.
One that suits you as an individual.
Yes.
Okay. So does the IUD method, does it have any side effects?
Well, they all have varying side effects. For the IUDs, you have the non-hormonal IUDs and you have the hormonal IUDs. The non-hormonal IUDs are the ones they call the copper T, and that lasts for about 10 years. Okay. But then it causes heavy bleeds. Sometimes it causes bleeds in between periods.
Okay.
And then for the hormonal IUDs, as they already have hormones in them, some of them could they stabilize your periods, they regulate heavy bleeding, but then hormones in your system, depending on the person, could have some side effects. You could have the blues, you could have feeling of nausea, bloatedness, depending. But then that stabilizes after about 3 to 6 months, and then you'll be fine.
All right, now let's come to the pills. How effective are the pills, and I'm sure they have different kinds of the birth control pills.
Yes, definitely.
So can you tell us?
Okay, for the pills, you have the combined oral contraceptive pills, COCs, and then you have the progesterone only pills.
Okay.
Now, the combined oral contraceptive pills are there are people who can't take them, right? So they have estrogen and progesterone combined. That's why they're called combined, and you have to go through a series of tests to know if you're eligible to use that. So for instance, if you have hypertension, if you've had any bleeding disorder previously, maybe a venous thrombosis or an arterial thrombosis, if you've had a stroke before, if you're a smoker and you're above 35, if you have migraines with aura, you're not eligible for the combined oral contraceptives. For it to work, you have to use it as prescribed.
Okay.
So you take one every day in the morning. You have the different regimens. You have the 21-day regimen where you take one every day for 21 days.
Okay.
So and then you have a 7-day inactive period, pill-free period. It's called a pill-free period. Side effects for the combined, usually you have migraines, you have nausea, you have moodiness, you have weight gain, you have elevated blood pressure, that kind of thing. Now for the progesterone only pills, even pregnant women can take them. Okay. That one doesn't have so much side effects as the combined oral contraceptive, right? But like I said, you have to go through a series of tests to know if you're eligible to use any of the contraceptive pills.
Okay. Right. Now, talking about pills, can you use any other method when you're using pills?
Yes, definitely.
Oh, really?
Yes. First and foremost, the condom is a form of contraceptive, which can be used with all the mentioned. The only time you can use the male condom is if you're already using a female condom, right? Then if you have a failure of your contraceptive, or if you missed a pill and you are not sure what to do, you can use a condom, or you can use a cervical ring as a combination.
Okay.
Yes.
So how does that cervical ring, how does it work? Where is it placed?
It's inserted. The cervical ring, the diaphragm, the vaginal ring, they all have the same mechanism. The woman inserts it herself, right? And then it covers the entry into the cervix. So it works with a spermicide to kill the sperm. So it just prevents the entry of sperm into the cervix.
Okay, so using birth control pills, does it result to any birth defects?
Well, so far I haven't come across any literature that has any documented birth defects.
Okay, yes. Resulting from birth control pills. Okay, now is there a risk of having trouble taking in after using birth control?
Yes, there's a delay. We call it a delay. So depending on what regimen you're on, some could have as high as 6 months delay. But some, immediately you stop, your chances are like every woman who never used contraceptive. So there's for varying drugs, they have varying degrees, and then also woman dependent.
Okay, so does birth control or birth control pills or birth control in general, does it prevent STDs?
It depends now.
Depends on.
Are we talking about barrier birth control?
Okay.
So where you're talking about your condoms, for instance, yes.
Yeah.
But other forms
Other
of birth
forms,
control,
no,
they don't.
Okay. So what happens when one forgets to take birth control pill and then your sex life is very active?
Well, that's why we have the emergency birth control pills. We have the emergency birth control methods, because there are three categories. One is the morning after pill, or the they call it Better Now. Forgotten the other name for it. You don't need a doctor for that. You can get it over the counter. Some people, I think we have one here, Postinol. They call it Postinol, yes. So that's an emergency birth control pill. You also have the Ella-1, is another emergency birth control pill. And then one of the IUDs, the copper T, is also used as an emergency contraceptive method.
Okay.
It's inserted immediately, and it will prevent any risk of unwanted pregnancy.
Okay.
So, but for the pills, you have a grace period from immediately after the sexual activity to as high as 5 days.
Okay.
But the sooner, the more effective. Right? So.
Okay. So how does one know which one of these control methods are the best? How do you know the one which suits you? You have to get advice from medical practitioners?
Well, you have to go through counseling. You have to be exposed to all the methods. And then you have to choose what works for you. And it depends on what stage you're in your life. If, for example, you're 40 and you feel you've completed your family size, you've had 3 kids, and you're sure you don't want to have any more kids, for instance, you could go for a tubal ligation. If you're 25 and maybe you've already had 3 kids and you want to wait it out, you could go for an IUD. So it depends on you. It depends on what's available, what you prefer, what side effects are comfortable for you, and so it's person dependent. There's no best for everybody. Yeah.
For people who have religious limitations to using birth control, what would you really advise them to do?
Well, that's why we have the traditional methods, or the fertility awareness methods. They're a bit tedious. They require cooperation from both the spouse and the person using it, and it also requires a woman's understanding of her body. So for the fertility awareness, you have various methods. You have the basal temperature method, where a woman wakes up every morning. Before any activity, she takes her core body temperature and records it, right? Now, it's been noted that when ovulation starts, the temperature increases a little bit from the normal. So she should record that pattern for probably another 6 months to understand how her body changes. And that's what she will use as a fertility awareness method. There's also the cervical mucus method, where the woman checks her cervical mucus every morning. She checks the color, she checks the stretchability of it. So when it's clear and it's stretchy, you're able to stretch it. It's called the Spain-Beckett's test. It means that you're ovulating. It means that you're fertile. It means that the sperm can permeate. But then when it's thick and it's not so stretchable, it means it will trap the sperm. So that's like your safe period. Right? Then there's the calendar method, which people call the Billings method. It's noted that ovulation starts 14 days before your menstrual cycle. So you're meant to calculate, and then you know your safe period by calculating when your ovulation starts to when you're going to menstruate.
But does it work for everybody?
It does. Every woman has that pattern, but you have to understand it. You have to understand yourself, and you have to always be aware that changes could happen. For example, you could be stressed, and your cycle could shift. For example, you could change location, and your date just changes to the woman around you. It becomes maybe closer. So you have to keep all those into cognizance, and then your partner also has to be cooperative. For instance, if it's not your safe period and then he wants to, have fun, it's either he cooperates or you use another birth control method.
You have to make him cooperate.
No, you can use another birth control method. You could use a condom, you could use a pill, or you could use the emergency contraceptive pill. There's also another method called the lactational amenorrhea method, LAM. That's after a woman gives birth. Breastfeeding, exclusive breastfeeding, and not the breast pump. exclusive breastfeeding suppresses ovulation.
Okay.
Now, it's safe, but it's risky.
Okay.
So it gives you a grace of about 6 months where you wouldn't, you would be safe, right? But then it's also kind of risky. So it has to be in women who are exclusively breastfeeding,
Okay.
right? That's the lactational amenorrhea method. It also has its failure rates. All the contraceptives have their failure rates, right? And then another traditional method is the withdrawal method.
And you mentioned that earlier.
Yes.
Yeah.
So that requires a lot of self-discipline, requires a lot
Yes.
of control, and also has its own limitations. For example, a pre-ejaculate could contain some sperm. So, and basically it just needs a lot of control.
Control, yeah.
Yes. So those are the methods that people who have cultural or religious limitations can employ.
All right. So are there any health risks involved in using birth control pill? Any risks? What are the benefits? Are there benefits, risks involved?
Well, so far, as for risks, the risks from contraception are not more than the risks from pregnancy. Okay. So once you're well informed, there are life-threatening risks if you're not well informed. If you go and get a contraceptive method for yourself, by yourself, without consulting the necessary authority, the necessary persons, right? But I think basically once you're armed with the information, you're able to minimize risks. But as a general overview, I'll just go through the side effects, the benefits and the side effects. You have benefits from using the hormonal contraceptive in that it protects you from endometrial cancer, from cervical cancer. Yes, and then you have from the condom, which protects you from STIs, various forms of STIs. You have also from the oral contraceptives that prevent, or rather regulate heavy menstruation, reduce the bleeding, and then prevents anemia as a result. You also have people who have acne. Some of these oral contraceptives corrects that. Yeah. Well, basically that.
I think that's quite a lot if you ask me. You mentioned cancer. What's
ovarian cancer and endometrial cancer?
Yeah,
but not breast cancer.
Okay, I want to get an explanation of that endometrial cancer.
Endometrial cancer, it's cancer from the endometrium. Now, when you're ovulating, ovulation takes place around the endometrium. Implantation takes place there. Now, when you have this oral contraceptive, they thin out the endometrium and they release the exposure, they reduce rather the exposure of estrogen to your endometrium. Estrogen is a cancer-growing chemical, right? So they reduce how much exposure you've had, and by that they reduce the risk of cancer.
All right, viewers, you're still watching Let's Talk Health. We'll go on this very short break, and when we come back, we'll continue. Stay with us. Welcome back. The program is still Let's Talk Health, and we've been talking about birth control, and I've been speaking with Dr. Toyin. So, doctor, at the end of the day, after all these explanations you've given to us now, it's your general advice for women out there? I think men also, yeah.
Yes, definitely. Well, there's this perception that contraception is targeted at the woman, because men don't have so much to lose. But I think it's important to note that it's a we problem. It takes two to tango, so it should take two to take responsibility, right? So we should try and become more aware. People should become more enlightened, and we should also try and get policies, talk to the government to make these contraceptive pills and all methods available, right? Available or cheaper. If not free, at least cheaper. Right? Because accessibility, availability, cost, those are usually some of the things that affect the user of contraceptive pills. So we should all be safe. basically.
Yeah. All right, thank you very much for coming on the show this morning.
Thank you very much.
It was nice having you. Okay, viewers, I hope you enjoyed this session with Dr. Tony. The program is still Let's Talk Health. To stay tuned. If you're just joining us, the program is Let's Talk Health, and I hope you've gotten informed like I always ask. This is where we call the program a wrap today. You can send in your questions, your comments, your contributions to the number on your screen via SMS and to the social media handles you can see. Well, until next time, as I always say, stay healthy, stay alive.